guys, welcome to my YouTube channel. So guys, in this video I will talk to you about what is malignant pleural mesothelioma treatment. So the introduction is malignant pleural mesothelioma (MPM) is a rare aggressive malignancy of pleural cavity linked to asbestos exposure. Despite recent treatment, advances prognosis remains poor with a median survival of approximately 1 to 5 years, survival around 10%. Use of asbestos has been banned in many but not all countries. The incidence of MPM is increasing worldwide, mostly in Eastern Europe, China, Brazil, Russia and India, and it is estimated that annually more than 25,000 people die from diseases. The observed can be thus probably explained at the tag time of 30 to 45 years of occurrence MPM after exposure to asbestos. So, standard therapeutic approach for MPM includes surgery and chemotherapy. Adjuvant radiotherapy is not standard and it can be considered only the highly selected group of patients with good performance status and appropriate renal and pulmonary function. Unfortunately, at presentation, most patients are not eligible and surgical resection and palliative chemotherapy is the only possible strategy. Cisplatin plus thermotechnics, doublet and standard treatment as its activity had been proven in the references phase 3 trial. Use of the combination significantly prolonged our overall survival by 2.8 months, the progression-free survival PFS by 1.8 million compared to cisplatin monotherapy. Materials and methods. Data from all 164 MPM patients were collected to oncological institutions, Narias, Klovoska, Theory and National Research Institute of Oncology, Cleviers and Krallo branch. Between 2013 and 2019, the reviewed retrospectively 106 patients were referred for either second options or for palliative radiotherapy, and there were excluded from the analysis. Additionally, 3 patients received treatment in the adjuvant setting and they were not included. Either 57 MPM cases were identified with full clinical data and received first-line therapy. Statistical method. PFS was calculated at the time from the start of the systematic treatment until disease progression as confirmed by radiological evaluation, clinical examination or until death from any cause. Patients without progression on the date of last follow-up were censored on the date. First line PFS and second line PFS were calculated separately on as defined as the time from the onset treatment until death from any cause. Patients who were alive on the date of the last follow-up contact were concerned. First line OS were second line OS were calculated separately. Treatment differences for PFS and OS were assigned using stratified long time test. So guys, this is the end of the video. Please subscribe my channel and press the bell icon button. So guys, in this video we have to talk about what is a malignant pleural mesothelioma treatment. It is a plural of mesothelioma treatment. The introduction. Malignant pleural mesothelioma. It is about 1 to 5 years survival of around 10%. The use of asbestos has been banned in many but not all countries. So standard therapeutic approach of MPM, including the surgery and chemotherapy adjuvant radiotherapy is not standard, and it can be considered only in a highly selected group of patients with good unfortunately. So, emphasis phase 3 trial use of the combination of significantly prolonged overall survival by 2.8 months from progression free survival FPS in 1.8 months compared to cisplatin monotherapy. So we have to prove the statistical method that PFS has was calculated at the time from the start of systematically treatment until disease progression as confirmed by radiological evaluation, clinical examination, or until death from any cause of the drink. These treatment differences for PFS and OS were assigned using significant log-rank test, and the 106 patients were referred for either second options for or for palliative radiotherapy, and they were executed for the analysis. Additionally, 3 patients received treatment in the adjuvant setting and they were not included. Either 57 mpm cases were identified with full clinical data and received first line therapy. So guys, please subscribe my channel and press the bell icon button. Thanks for watching the video. Bye.